Okay, this is important. We have to stop with the Benadryl. I'm Tiffany. I'm a physician assistant. I'm also a GLP-1 advocate. So I spend a lot of time talking about health and wellness on my channel. I also spend a lot of time helping people get access to GLP-1s. If you're struggling with that, then there's some links over here in my bio that hopefully can help you out. So Benadryl has been in our medicine cabinet for literally decades, but some providers are saying it might be time for us to stop using it. Find out why. So Benadryl is also known as diphenhydramine, which is the generic name. It's been used since the 1940s. Most common uses are allergies, hives, bug bites, and even a sleep aid. It's considered a first-generation antihistamine, and let me tell you, it comes with some baggage. So for most people, Benadryl makes them drowsy, but it can actually last on into the next day. For others, they also have the additional side effects of having constipation, dry mouth. It can even cause urinary retention where it makes it hard to pee, and it also can cause some issues with arrhythmia of the heart. Here's one thing you may not know is Benadryl can actually cross into the brain. So it crosses something we call the blood-brain barrier. So it blocks two things. It blocks histamine and acetylcholine. So in your brain, that can impair your memory and your focus and your ability to be alert. Now that's just in the short term, but long-term use of Benadryl has actually been linked to increased risk of dementia, especially in older adults, because it's blocking that acetylcholine, which is a very important neurotransmitter in your brain. Blocking that can lead to decline in memory and ultimately Alzheimer's. And if you're thinking, oh, I'll just take Benadryl one night for sleep, then buyer beware, because studies actually show that taking Benadryl in the evening the next day can impair your driving more than being over the legal limit of alcohol. So what do we do instead? So the thing to do is to switch to the newer second generation antihistamines. Those include things like Allegra, Claritin, or Zyrtec. Those generally last longer, are safer for your brain, and don't generally make you a zombie the next day. Now, should we completely throw Benadryl away? Well, maybe not really. I think it still has its place in certain occasions. So if somebody's having an acute allergic reaction or severe anaphylaxis, then Benadryl can be very helpful because it works within 15 to 30 minutes. So that's generally what we're wanting. And then there are sometimes situations where sleepiness can be beneficial and we don't necessarily have to be alert the next day. So sometimes we want that. So I think as long as you use Benadryl wisely, then you don't have to completely get rid of it. But I think by and large, we don't need to be overutilizing Benadryl like I know a lot of you are. Okay, so let me know down in the comment section. I want to know, how often are you really taking Benadryl and how much do you take at a time? So if you like this, then follow me for more health related stuff.